Hi, this is Dr. Divakar Bhat, cardiothoracic and vascular surgeon working at Aster Hospital, JP Nagar, Bangalore. Many of my patients are diabetes, and majority of our patients and their relatives ask me a question. So, why diabetic patients or diabetic persons have heart problems more, and what is the reasons for all those things? See, first we should understand diabetes is nothing but a sugar disease. It has become a part of our life. In Bangalore or in India or in Asian countries, we tell 3 out of 5 people we encounter will have a high sugar, and we can call that as diabetes. Most of the time, the moment we utter the word "you have a diabetes," his half strength goes down and they become sort of depressed. Please understand, diabetes is not a disease. It is just a lifestyle. It's a metabolic disorder wherein your sugar metabolism is not right. We tell oxygen, water, and sugar are 3 main ingredients required for sustenance of our life. In this, our sugar metabolism is not just right. But if you know how to control that with regular exercise, your diet patterns, and if your doctor prescribes some drugs, if you take them and if you control your sugar properly, this is not a disease. This is just a variation in your life. See, for example, we tell someone gets frequently angry. That's not a disease, that is his nature. Same way, diabetes we tell, but please understand, control is very important. If you are not keeping the diabetes under control for more than 5 years, then it becomes your enemy. You will get all the diseases which you can name. It can affect your brain, it can affect your lungs, heart, kidney, eyes, everywhere, or you can develop gangrene. So, I being a heart surgeon, I encounter a lot of problems, and I would like to tell what are the main things, the main connection between diabetes and heart. See, in diabetes, what happens is the diabetic person's blood will become like a sugar syrup. We want the blood to be thin like a water so that it circulates throughout your body nicely and you will enjoy your good health. If your blood is thick like a sugar syrup, naturally you can imagine it can coat everywhere, every small vasculature it gets affected. The same way heart blood pipes like coronary arteries will develop a blockage. Anybody above 5 years if has got a diabetes, thorough checkup is must. This is because we tell in diabetes that person may not get a typical symptom of angina or chest pain on exertion, or he may not have a ECG changes. That's because all the nerves will be damaged by this high sugar. The only way of detection is regular checkup by a qualified person. The another thing what I've seen in my 30 years experience is many patients tells me, sir, I have a high sugar for last 20-25 years. My general physician or so and so doctor gives me drugs, and this was under thorough control for all these years. But for some reason, for last 3 to 5 months, my sugar is not under control. I always tell this is an indication that is onset of the heart disease. So please have a thorough checkup. Impairment of your sugar management may be an indication that you are developing a heart disease without any symptoms. So 2 things I would like to stress: in diabetic, heart problems onset will be totally asymptomatic. They may not get a typical chest pain. The only way is approaching your doctor, having a regular checkup, prevent the major problems. Once again, I am stressing proper sugar control is a very important, then it will not be a disease. So hence, have a regular checkup, reach your doctor regularly. At Aster RV Hospital, we have all the facilities for this. We have endocrinologist, diabetologist, regular checkups. So in diabetes person, I advise every year full body checkup including treadmill test and echocardiogram. Please take use of these facilities and avoid major problems. Thank you.